Is your toenail lifting becoming distorted or repeatedly being treated as an ingrown toenail, but never completely improving? The problem may not actually be the nail itself. Occasionally, a small benign bone growth develops beneath the toenail and gradually pushes the nail upwards. This condition is called a subungual exostosis because it can resemble an ingrown toenail, a wart, an infection, or excessive tissue growing around the nail. Diagnosis is sometimes delayed. In this video, I'll explain what a subungual exostosis is, why it develops, how it is diagnosed, and when surgical removal may be appropriate. Hello, I'm Dr. Damien Lafferty, a surgical podiatrist based in Sydney, Australia. A subungual exostosis is not particularly common, but it is an important condition to recognise, especially when someone has persistent pain, swelling, or nail deformity that has not responded to ordinary nail treatment. The term sounds complicated, but it becomes much simpler when we break it down. Subungual means beneath the nail, while exostosis describes an abnormal growth of bone. Therefore, a subungual exostosis is a bony growth arising from the end of the bone beneath or close to the toenail. It most commonly affects the great toe, although it can develop beneath the nails of the smaller toes and less commonly the fingers. Importantly, it is generally considered a benign lesion. That means it is not normally cancerous. However, any unexplained growth beneath the nail still needs a proper clinical assessment. What does a subungual exostosis look and feel like? The condition commonly begins as a firm lump beneath the nail or near its edge. Because the space beneath the toenail is extremely limited, even a relatively small growth can cause significant symptoms. As the lesion enlarges, it may push the nail plate upwards and separate it from the underlying nail bed. This is known as onycholysis. The nail may become raised, curved, thickened, distorted, discolored, or unusually difficult to cut. Some people develop a tender pink or red mass protruding from beneath the nail. The overlying tissue may become irritated, ulcerated, or bleed after pressure from footwear. Pain is usually caused by pressure between the bony growth, the nail, and the shoe. It may initially occur only in tight footwear or during sport, but it can become more persistent as the lesion enlarges. These features can easily be mistaken for an ingrown toenail or a nail infection. Is a subungual exostosis the same as an ingrown toenail? No. They are different conditions, although they can produce similar symptoms. An ingrown toenail occurs when the edge of the nail irritates or penetrates the surrounding skin. A subungual exostosis is a solid bony growth beneath the nail. This distinction matters because repeatedly trimming the nail, removing part of it, or prescribing antibiotics will not remove an underlying bone lesion. A useful warning sign is a nail that remains elevated or distorted despite apparently appropriate ingrown toenail treatment. Another clue is a very firm, fixed lump beneath the nail rather than soft inflammatory tissue alone. That does not mean every painful or distorted toenail contains an exostosis. Ingrown toenails, fungal infections, and traumatic nail damage are far more common. The important point is to reconsider the diagnosis when the presentation is unusual or treatment repeatedly fails. What causes subungual exostosis? The precise cause remains uncertain. Previous injury, repetitive pressure, infection, and chronic irritation have all been proposed as contributing factors. Approximately 30% of patients in one systematic review reported previous trauma. However, that association does not prove that trauma directly causes the condition, and many patients cannot recall any particular injury. Repetitive microtrauma from sport, tight footwear, or pressure against the end of the toe may potentially play a role in some cases. Subungual exostosis can occur at different ages, but it is frequently reported in children, adolescents, and young adults. In the same systematic review, slightly more than half of the patients were younger than 18. It should not automatically be dismissed as ordinary growing pain or shoe pressure simply because the patient is young. How is it diagnosed? Diagnosis begins with a careful examination of the toe and nail. The clinician will look at the position of the swelling, whether the nail plate is elevated, whether the lesion feels firm, and whether there are signs of infection or another nail disorder. The key investigation is usually a plain X-ray because a subungual exostosis contains bone and arises from the distal phalanx. The small bone at the end of the toe, it can generally be identified on an appropriate radiograph. Different X-ray views may be required because a small lesion can occasionally be difficult to appreciate on a single image. Ultrasound, Connecticut or MRI may be considered when the diagnosis remains uncertain or more anatomical detail is required, but they are not routinely necessary for every case. Following surgical removal, the specimen should ordinarily be sent for histopathological examination. This confirms the diagnosis and helps exclude other lesions. What else can look like a subungual exostosis? Several conditions can resemble it. These include an ingrown toenail, a viral wart, a pyogenic granuloma, a glomus tumor, an osteochondroma, chronic nail bed trauma, and other benign or malignant nail unit lesions. A lesion that is changing, bleeding, unusually pigmented, persistently ulcerated, or failing to heal deserves prompt assessment. Although subungual exostosis is usually benign, it is not sensible to diagnose every lump beneath the toenail by appearance alone. Does every subungual exostosis require surgery? Not necessarily. Management should be based on the diagnosis, the severity of symptoms, the progression of the lesion, and the amount of nail disturbance. A small confirmed lesion that is not painful and is not progressing may sometimes be monitored. However, footwear changes or nail care cannot make an established bony growth disappear. When the lesion is painful, enlarging, damaging the nail, or repeatedly breaking through the surrounding tissue, surgical excision is usually the definitive treatment. How is a subungual exostosis removed? The procedure is commonly performed using local anesthetic to numb the toe. The operative approach depends on the position and size of the lesion and whether the nail bed has already been damaged. In some cases, the lesion can be approached from the end or side of the toe, helping preserve the nail plate and nail bed. In other cases, part or all of the nail may need to be temporarily lifted or removed to provide safe access. The bony growth is excised down to its attachment and its base is carefully contoured or curated. The removed tissue is then sent to pathology. The aim is to balance two important objectives: completely removing the lesion to reduce the risk of recurrence, while protecting the nail bed and nail matrix to reduce the risk of permanent nail deformity. This balance is important. An incomplete excision can allow the lesion to recur, while unnecessary injury to the nail matrix can permanently alter nail growth. What is recovery like? Recovery varies according to the size of the lesion, the operative approach, and the amount of nail bed involvement. The toe is normally dressed and protected after surgery. Patients receive instructions about wound care, footwear, activity, and signs of infection. There is usually some post-operative discomfort, swelling and sensitivity. Elevation and appropriate pain relief may be recommended. A roomy post-operative shoe or open footwear may initially be helpful. Return to ordinary shoes and sports should be guided by wound healing rather than by a fixed date alone. If the nail has been removed or significantly lifted, it can take many months for a new great toenail to grow forward. The final appearance also depends on how much damage the exostosis had already caused before treatment. Can a subungual exostosis come back? Yes, recurrence is possible, particularly if part of the lesion remains. A systematic review reported recurrence of approximately 4% following complete marginal excision using a nail-preserving approach. Other published series have reported variable results because the available evidence is mostly based on retrospective case series rather than high-quality clinical trials. The practical message is that complete excision matters, but so does careful handling of the nail bed. Younger age has also been associated with recurrence in some research. Follow-up is therefore important. A returning lump, increasing pain, or renewed nail ablation should be reassessed, sometimes with a repeat X-ray. A subungual exostosis is a benign bony growth beneath or adjacent to the nail, most commonly affecting the great toe. It can cause pain, a firm lump, separation of the nail, and progressive nail deformity. Because it may look like an ingrown toenail, wart, or infection, the diagnosis is sometimes missed. A clinical examination combined with an X-ray will often identify the underlying cause. When the lesion is painful, enlarging or damaging the nail, surgical excision may provide definitive treatment. The procedure needs to remove the growth adequately while preserving the nail bed and nail matrix wherever possible. If you have a painful lump beneath your toenail or a nail that remains distorted despite previous treatment, arrange an assessment rather than continuing to treat it as an ordinary nail problem. I'm Dr. Damien Lafferty, surgical podiatrist in Sydney, Australia. This video provides general educational information and cannot diagnose an individual condition. Your treatment should be based on a personal clinical examination and appropriate imaging. If you found this explanation helpful, please subscribe to the channel. You can also leave a general question below. It may become the subject of a future educational video.